Hi everyone, welcome to Radiology Recall session. So if you see the question paper this year, you will find that there were more number of questions from radiology. Usually there will be around 4 to 6 questions from radiology, but what happened this year is there were 11 questions from radiology. And if you go through the questions, you will understand that the question seems to be very easy, but the options were a little tricky, making these questions moderate to tough in difficulty level. Okay. So after each and every year, we will understand that the pattern is changing little bit, but the importance of previous year questions still remains the same. And most of the questions which were asked in which were asked in the exam was discussed by us in our routine classes. So we will discuss one by one. First question, this is actually one of the favorite question of examiners. First, this question was introduced in FMG. Then this question was asked in INICET. Now again, they have repeated this question. In this question, they are asking you to find out identify the anatomical structure which they are given. So some students were telling that this arrow was pointing towards the anterior roof, and some were telling that the arrow were pointing towards the posterior roof. So whatever it is, if they are showing you an arrow like this, and if you're seeing the ribs horizontal like this, that means it is posterior rib. Okay, if the rib that they are showing is horizontal in orientation, then that means it is a posterior rib. And if the rib that they are showing is obliquely placed like this, then it will be anterior. So the answer will depend upon the orientation. And remember, if they are showing you this structure, this is pulmonary artery, and costal cartilage is not well visualized in a chest radiograph. An X-ray image will not depict costal cartilage very well. So costal cartilage is not the answer. So if the arrow point towards a horizontally placed rib, then it is a posterior rib. Or if the arrow places towards an obliquely placed rib, then it is an anterior rib. So there is a discrepancy among students. Some are telling that it is posterior rib, some are telling it is anterior rib, whatever it is. So you should be strong in the concept. Okay, if the arrow is pointing towards the horizontally oriented rib, then it is posterior rib. Or if it is oriented to, if it is given directed towards the obliquely oriented rib, then it is an anterior rib. Okay, that is the concept. So first question is very easy. And coming to the second question, actually this was a tricky question because in the question they gave you a contrast CT image. Why contrast? Because the vessels were opacified by the contrast. So they gave a contrast CT image, and in contrast CT image they asked you to find out the anatomical variant. They asked you to find out the anatomical variant, and the options given were tracheal diverticulum, double esophagus, ARSA, that is aberrant right subclavian artery, and right arch of aorta. So if it is right arch of aorta, then this is the arch of aorta, then the aorta should be coming like this. Okay, so this is not double arch of aorta, right arch of aorta. Double esophagus, you will be able to see two esophagus, and tracheal diverticulum, you will be able to see a air-filled structure adjacent to the trachea. But in this, what we were seeing is there is a vessel passing behind the trachea and esophagus. So this is the trachea, and behind the trachea and esophagus, a vessel is passing. So if you are seeing a contrast-filled structure or a vessel arising from arch of aorta and passing posterior to the esophagus, posterior to the trachea, then it is nothing else. Then it is aberrant right subclavian artery. So that is the concept. If you are seeing a contrast-filled structure passing posterior to the trachea and esophagus, then it is aberrant right subclavian artery. So in this course exam, actually this is a tough question. Actually, even first year radiology PGs will find it difficult to find out aberrant right subclavian artery. So I don't know why these people are asking these questions, but this was the case of aberrant right subclavian artery. And actually, we have discussed about aberrant right subclavian artery in our classes when we discuss about dysphagia lusoria. Okay, when we discuss about dysphagia lusoria, we will be discussing about aberrant right subclavian artery. What happens is the vessel which is passing posterior to the esophagus will compress the lumen of esophagus. Okay, so this is actually an image from our workbook showing aberrant right subclavian artery. This year they have given a CT image and asked you to find out this anatomical variant. Now, the third question, this was actually easy because this was a patient after trauma, stab injury to the chest, and supine X-ray radiograph was given. So here, this is the right side and this is the left side. And if you know that this right side is pathological. So this, here you are seeing opaque right hemithorax. So there is complete opacity. You are not able to see any air shadow. There is no radiolucency in right side. So you can easily eliminate the option of right pneumothorax because it is not pneumothorax. What will be seen as opaque hemithorax? When there is fluid or when there is blood filling one hemithorax, you will be able to see opaque right hemithorax. So this is a complete or massive right hemothorax or right pleural effusion causing opaque right hemithorax. Okay, so the answer is right hemothorax. In diaphragmatic rupture, we will be able to see elevated diaphragmatic borders like this. You are not able to see any diaphragm here, so it is not diaphragmatic rupture. And pulmonary contusion actually not well visualized in X-rays. It is usually actually very well depicted by CTs. Okay, it will appear as ground glass densities in CT. Even in X-ray, what happens is you will be able to see some patchy opacities. It will not be a one side complete opaque thorax. Okay, so when you are seeing opaque right hemithorax, what you have to understand that it is actually either fluid or blood filling one side. So this is a case of right hemothorax. So that was third question. And fourth one is actually a direct question. Nowadays, they are not directly asking you the science, but in this exam, they ask you to find out the answer for what is Mount Fuji sign or where you are seeing Mount Fuji sign. Okay, and they give 4 different options like tension pneumoperitoneum, tension pneumothorax, tension pneumocephalus, tension pneumomediastina. So in our class, we have discussed it multiple times. When you are seeing air density, see, this is a CT image of brain. Here you are able to see the air densities like a shape of M. So if you are seeing air densities like this in the frontal region in CT brain, so this is Mount Fuji sign. What is Mount Fuji? Mount Fuji is actually a mountain which is seen in Japan. Okay, this is actually a mountain which is seen in Japan. So Mount Fuji sign is seen in tension pneumocephalus. It is seen in cases of tension pneumocephalus. It is seen in tension pneumocephalus. This is actually a straightforward direct question. Okay, nowadays these type of questions are very, very rarely asked. So fourth question was actually easy. If you have gone through our notes, if you have revised our notes well, then it will be easy. So when you are preparing for NEET, make sure you are going through, you are revising thoroughly each and every point from our workbooks. And actually, after seeing this question, I was very happy because on the day just before the exam, we released one PDF containing 2 pages of important points, and the first table in that PDF contained the answer for this. Okay, so contrast that can be given in renal disease patient. So the examiner is asking you which contrast agent is renal safe. So you have to understand whether you are doing a X-ray, IVU or AUG or whatever contrast investigation, including iodinated contrast or any CT investigation involving iodinated contrast, we have to look for the renal function test of the patient. Similarly, when you are giving gadolinium, also you have to check for the renal function test of the patient. Okay, so because what happens is all these contrast agents are excreted through the renal route. So all these contrast agents can result in kidney damage. So these contrast agents, whether it is iodinated contrast agent or a gadolinium based contrast agents, all these contrast agents are excreted through the kidneys. So these contrast agents can result in kidney damage. So you have to check renal function test, and these contrast agents should be avoided in cases of renal damage or chronic kidney disease. So the contrast agent which is safe to be given in a renal failure patient is USG contrast agent. So ultrasound contrast agents are usually microbubbles. Ultrasound contrast agents are usually microbubbles, which are usually made up of sulfur hexafluoride. And since they are bubbles, they are excreted by lungs. These are excreted by lungs. So these are renal safe. So if you had gone through the table on the day before the exam, then you would have never made these things wrong. So that is the importance of revision. So this is very, very important point. Contrast agents are very, very important for exam, both NEET and INICET. So you have to understand that microbubbles are used as ultrasound contrast agents, and these microbubbles are excreted through lungs. So they are renal safe. So that is the take-home point. Now coming to the sixth question, actually they gave an X-ray like this and they asked for the diagnosis. Actually, in a X-ray knee, if you are given an X-ray knee, you will be able to find out patellar fracture, tibial condyle fracture, and this hemarthrosis is very difficult to be diagnosed by radiograph alone. Rheumatoid arthritis also not that easy to diagnose with a single plane radiograph. Okay, if they are giving you bilateral radiograph of wrist or hand, then you can make the diagnosis of rheumatoid arthritis. So most probably in exam, the answer should be either patellar fracture or tibial condyle fracture. And most of the students are telling there was a lucency like this in the region of patella. So the answer for this question is patellar fracture, not tibial condyle fracture. So answer for this question is patellar fracture. So actually this is a direct straightforward. You have to eliminate the possibilities which are difficult to be diagnosed with radiograph. And then you have to thoroughly look the image. You should see in tibial condyle as well as in the region of patella. And if you are seeing a lucency like this in the region of patella, then it is patellar fracture. So this is the sixth question. So usually there will be only 6 to 7 questions, but this time the number exceeded more than 7. Okay. Another direct straightforward question regarding CT. They asked what is true about CT. And the first point was water has an HU value of 0. Second is unfiltered X-ray beam is used for CT. Third one was CT head dose is 20 millisieverts, and fourth one is CT is the first investigation for gallstones. So you know this is absolutely wrong because some of the gallstones will be radiolucent because the gallstones are made up of cholesterols. Gallstones are made up of cholesterol. So CT may miss gallstone. And I have told you repeatedly, ultrasound is the investigation for gallbladder and gallstone. So this is wrong. And remember, for a patient, remember this is head, chest, and abdomen. And when you come to the radiation dose, head, if you're taking CT head, it will be having around 2 millisieverts. CT chest will be having around 4 millisieverts, and abdomen will be having a dose of around 6 millisieverts, 6 to 8 millisieverts. So actually, this is a rough idea. So it is not 20, it is actually 2 millisieverts. For the CT brain or CT head, it will be around 2 millisieverts. For CT chest, it will be around 4 millisieverts. And for CT abdomen, it will be around 6 to 8 millisieverts. Okay, so you have to remember it like that. And actually, this is one of the easiest option. If you know, HU value of water is always 0. That is the first basic concept that we read about HU value. Hounsfield value for CSF or water is actually 0. So this is the correct answer. And you have to remember always we are using filtered rays. What happens if you are using unfiltered rays is the high energy radiation in unfiltered rays will penetrate through our body, and the low energy rays will be deposited in the skin, resulting in more damage to the skin. So we are not using unfiltered beam, we are using filtered X-rays for CT. So that is the concept. Okay. So the answer for the question is the HU value of water is 0. All other 3 options are wrong. So that is actually another straightforward question. And during exam, it is very difficult for you to think about each option and sort it out. So if you know some fact like HU value of water is 0, CT dose to the head is 2 millisievert. Like if you know some facts, then it is easy for you to figure it out which of the following is correct option. So you should try to memorize some of the facts and try to read these facts 1 or 2 days prior to the exam. Okay, that is the key concept. Actually, when we see the recall, you may feel all these are very easy, but it is actually not easy when you are getting around only 30 to 45 seconds for a question. Okay, your brain, your thoughts should be processing fast, so it is difficult for you guys. So you should try to remember these things with the help of mnemonics or by repeated revision. One radiogram, one CT, actually CT image of thigh with the femur was given, and they asked you the diagnosis like this. Okay, so from the students, some of them were telling that the bone cortex was thick and there were some defects were opening in cortex. Most of them, they were telling that there were some opening in the cortex like this. So if you are seeing dense, that is bright, thick cortex with some opening in the cortex, then it should be cloaca. Okay, it should be cloaca. And if it is cloaca, then definitely there is nothing else. This chronic osteomyelitis. Okay, so from the recall, I got to understand that the given image had thick cortex with some of the openings in the cortex. Okay, so if you are seeing a thick cortex with some opening in the cortex, then it is cloaca. What happens in osteosarcoma? In osteosarcoma, you will be able to see sunray-like periosteal reaction. It will be actually classical. It will be, what happens is, if it will be like this, okay, sunray-like periosteal reaction. And what happens in Ewing sarcoma is there will be onion peel like periosteal reaction. Will be onion peel like periosteal reaction. So this is the concept. How onion peel will be seen is it will be seen like this. Okay, onion peel like periosteal reaction. So if you are seeing this periosteal reaction only, then you should go for the options of osteosarcoma and Ewing sarcoma. Otherwise, if you are seeing thick cortex, because it is dead bone, there is no resorption going on. So the bone will appear thick. There will be some holes for the pus to come out. That is cloaca. So that is cloaca. Sometimes you will be able to see involucrum and secustum also. And finally, there was actually a direct, straightforward question. A question which all we used to discuss every year. A question which I have included in the last day's PDF. That is achalasia cardia. Whenever there is a history of difficulty in swallowing, weight loss, difficulty in swallowing for fluids more than solids, and a classical image with the classical bird peak appearance, that is smooth tapering showing bird peak appearance, you should think in terms of achalasia. You should never confuse it with the carcinoma esophagus, because since the patient is having dysphagia, both these patients will be having loss of weight and loss of appetite, because the patient is not able to eat anything. So definitely there will be loss of weight, loss of appetite. It is barium studies as well as the biopsies that will help you to make the diagnosis. If the narrowing is smooth, then it is achalasia. If the narrowing is very irregular like this, then it is carcinoma esophagus. Okay, again, a topic that we have discussed again and again. So this was a classical image of achalasia. So these are the 9 straight questions, direct, straightforward questions that came from radiology. Actually, most of them were from our workbook only, because we have discussed most of these questions. That aberrant right subclavian artery, cloaca, as well as that patellar fracture is actually very difficult to find out if you are not properly looking through the images and options. Okay. Anyway, the exam was moderate to tough one, so don't worry. But you should be prepared well for the upcoming NEET exam. And finally, 2 questions which were integrated. One was they gave an image of EDH, and in history there was pupil involvement. So actually, when will pupil involvement come? When the EDH is very large and pushing the brain parenchyma to the opposite side, that will result in midline shift and herniations like ankle herniation, descending transtentorial herniations. Okay. So during the mass effect, this because of mass effect, we will get this pupil involvement and all. So when you are seeing a extradural hemorrhage with mass effect causing pupil involvement or any other neurological impairment like this, you have to operate. You have to evacuate the hematoma. So actually, what we have to do is we have to go for craniotomy and remove evacuation of the hematoma. So that was the answer for the question. And another question, which there was a long history of fever, chest pain like that, and shortness of breath like that, and image was given. So image had money bag appearance like this. Money bag appearance like this. So this was a case of what? Pericardial effusion. This was a case of pericardial effusion. And what happens in pericardial effusion? There is a pad known as Beck's triad, in which there will be muffling of the heart sounds. So this pericardial effusion can cause collapse of right atrium. It can cause pulsus paradoxus. It can, and if it is an emergency condition, you have to do pericardiocentesis. All these sentences are correct. And actually, what is wrong is this one will not be loud. There will be muffling of the heart sounds. Okay, there will be muffling of heart sounds. So actually, that is the answer. So this is the question that came from pericardial effusion. Okay. So these were actually the 11 questions which came related to radiology. Around 9 were straightforward questions from radiology. 2 were integrated with the other clinical subjects. So In NEET also, last NEET also, there were around 12 to 13 integrated questions with radiology. So you have to pay enough attention to radiology. Please take some time, go through your notes, go through our workbooks, notes, as well as VSV notes before you finish radiology revision, because since it can be asked as an integrated subjects, you can expect some more questions, around 10 questions in NEET exam also. So forget about our INICET anyway. Whatever done is done. So you should never waste time thinking about INICET. What you have to do is you have to start preparing for NEET. Okay. So all the best, guys. Thank you so much.